Well, it's a busy morning here on Morning Live, and moving on to the next story now. The 13th BRICS Health Ministers meeting will conclude today at the Inkosi Luthuli International Convention Centre in Durban. Now, among some of the critical health discussions held, the four-day event called for BRICS member states to intensify their efforts in achieving equitable access to affordable and quality health care for all citizens, irrespective of their socio-economic status. Now, to tell us more about what they have managed to achieve, we are joined virtually by the Minister of Health, Dr Joe Phaahla. Dr Phaahla, thanks so much for your time. Welcome to Morning Live.
Sakina, I hope you can hear me. It keeps breaking. Can you hear me?
I can hear you now, but you're right. It certainly keeps breaking. So let's try and keep it as short and sharp as we can, Minister, before we lose the connection. Minister, later this morning, you will join your counterparts from the other BRICS nations, Brazil, Russia and China, to adopt a declaration, which of course will include the establishment, as we understand, of a BRICS nuclear medicine establishment to prevent and reduce the risk of deaths from oncology diseases and also improve the quality of life of palliative care patients. So speak to us about that, please, Minister, and also the significance of the document you'll be signing.
Well, thank you very much for having us this morning. Indeed, our counterparts are already here at Tekwini. We already hosted them for a dinner last night. So this morning we'll be starting with the real business. But the senior officials have been hammering out the documents, including the declaration. And as you mentioned, amongst others, will be adopting, amongst others, a resolution on cooperation in the area of nuclear medicine. Now, this is an area in which, as South Africa, we quite moving very fast. We have been there for some time. We do have experts. Some few weeks ago, our counterparts, our colleagues in the science and innovation were also launching an isotope production facility in Cape Town. But as some of people might be aware that we do have quite a strong nuclear medicine facility at Steve Biko Hospital. Amongst the facilities, of course, which produces the isotopes is a facility called Pelindaba, just outside Atteridgeville, which is a part of the Nuclear Energy Corporation of South Africa facility. So this is a technology which helps to diagnose various forms of cancer, but also in terms of treatment. But just to mention other areas, of course, in which we will be collaborating, we appreciate the fact that we are able to meet physically because COVID-19 is no more a pandemic. But we know that our scientists are telling us that the risk of future viral pandemics. So we will be looking at early warning systems, cooperation amongst the 5 countries, to work together in surveillance, work together in terms of laboratory capacity and also genomic surveillance to make sure that each one of us, when we pick up something which can be a risk, we don't only report to the World Health Organization, but we also share information amongst ourselves. Just to mention a few of other areas, in the area of TB, TB is also a major burden for all the 5 countries. We account for 40% of the world TB burden, and we'll be sharing information on further research in terms of better diagnosis of TB, early diagnosis, better, more effective and safer treatment, and including also exploration on the vaccine of tuberculosis. So that's just some of the highlights which we'll be finalizing later this morning, Sakina.
And very important, those touch points, Minister. You know, you speak about vaccines, and we saw what happened with COVID-19, and international property rights has been a major health access issue for developing countries in particular. So was there any sort of resolution taken on this matter?
Well, definitely there's proposals which the ministers will look at to reinforce our cooperation in the area of vaccine production. The issue of intellectual property is, of course, a very hot topic at the World Trade Organization. There are countries which are not very happy to share information not only on vaccines but also on other pharmaceuticals. Now, within these 5 countries in the area of vaccine production, while of course the bigger dominant producers were in the Western countries, but from the eastern side, you would be aware that both China and Russia were moving very fast. They did produce vaccines, some of which we also registered in South Africa, such as the Sinovac from China. We had some difficulties with the Sputnik. Our regulator, SAPRA, had some other issues which needed to be resolved. But we working very closely. And of course, here in South Africa, we were lucky enough to be identified by the World Health Organization to be an mRNA hub for production of vaccines for COVID and also for other infectious diseases. So this also, we will be adopting a resolution on sharing all the information available amongst the 5 countries in as far as vaccines production, including, as I mentioned, also in the area of possible vaccines to prevent tuberculosis.
So, Minister, it all sounds really fantastic, but breaking it down to the ordinary South African, of what benefit is this particular event? It is, of course, a build-up activity for the BRICS summit that takes place from the 21st to the 25th of this month. But for ordinary South Africans looking on, now you've explained to us, the sort of negotiations that have been going on and the agreements that you've entered into as a government. But if you were to give a message now to ordinary South Africans, what would you say the benefit is to them in layman's terms?
Well, in layman's terms, we're trying to use the capacity of the know-how. We're talking here about this. The 5 countries put together account for just over 1/3 of the world population. So if we can share the expertise in medicine production, in vaccine production, in various forms of investigation into hazardous diseases, and make sure that we don't duplicate our resources and we share, including also in terms of the training of experts. We're looking also here, for instance, on the area of digital health systems, where there is a lot of advancement, where you can be able to diagnose the diseases quickly, you can treat more cost effectively. So the benefit will be that when some of these areas mature, whether it's in vaccine, whether it's in medicine, whether it's in diagnostics, or in broader just systems of healthcare, we can be able to provide better services at the more cost effective. We know that we don't have adequate resources. So the more we work together, the more we cut down on cost, and the more we can expand services to our people. We are the smallest part of the BRICS, so we want to use the experience and the size of these other countries and their depth of technology as well, so that we can speed up some of the areas of improvement for our own people in terms of improvement of health services.
Minister, we'll keep following these developments. Thanks so much for your time, for bringing us up to speed with what's been happening as well. That's Dr. Joe Phaahla, South Africa's Minister of Health, talking to us about the 13th BRICS Health Ministers meeting that concludes today at the Inkosi Luthuli International Convention Centre in Durban. And this, of course, also gives us a sense of the department's preparedness, their readiness for their participation in the summit when it takes place later this month.